Hi, my name's Melissa Wooten. All my life, I always said I didn't know what I would do if I had a child with a disability and how it would affect my life. Well, that unfortunately came true. In 2005, I gave birth to a beautiful little girl named Gia Nicole, and she was the most precious gift that I was ever given. Gia was a perfectly normal baby all the way up until a year old when her doctor asked me if she was pulling herself up in her crib yet or walking or crawling or anything, and I told him no. So the doctor sent her to the neurologist to have tests done. We went through all these tests to get done, and the neurologist couldn't come up with anything, so he sent me to St. Pete to have more testing done. Well, when St. Pete ordered the tests were for Rett syndrome, Asperger's syndrome, and Angelman syndrome. I'll never forget the day that I got the phone call telling me that one of the tests come back positive, which was for Rett syndrome. So I had to go back to St. Pete and go over a lot of testing with Gia and everything. So I wanted to inform you about what Rett syndrome is and how it affects our children. Rett syndrome is a disability that is affected by the X chromosomes in the female organism. One of the X chromosomes shuts down between 6 to 18 months old, and that is what tells the body what to do, all their cognitive skills and everything. They're perfectly normal when they're born. There's no way of detecting it. There's no way of detecting it when you're pregnant or even after you have them. They can walk, talk, crawl, do everything normal like a regular child would do. But unfortunately, between 6 to 18 months old, one of those X chromosomes shuts down and they lose all of their abilities. Their balancing, their muscle tone, speaking, feeding, everything. It just takes complete control over the whole body. There is no life expectancy on Rett syndrome. So you live every day wondering when is the day that your child is going to be gone. Males cannot catch Rett syndrome because it is due to the X chromosomes. Males have an X and a Y chromosome as the females have two X chromosomes. So if the male gets it and their X chromosome shuts down, they basically die in the mother's womb because they don't have that extra X chromosome to function off of as the females do. The extra X chromosome that the females have to function off of, it, like I said, has no life expectancy on it. So you live every day wondering. They could live all the way into their 50s. They could live, until they're 4. You just never know. Seizures come along with the disability as well. And that's what happened with my daughter. She had a seizure 1 month before her 4th birthday and passed in her sleep. Rett syndrome is caused by the female's X chromosome shutting down, and that is what makes the body function correctly. Only females are affected by Rett syndrome because of it being due to the X chromosome. Rett syndrome is so rare that it is 1 out of 10,000 to 15,000 births a year that get it. And it has nothing to do with the mother or the father or anything. It's just a rare disability that the girls get. And there's no stopping it or controlling it. The first sign of Rett syndrome is hand repetitive to the mouth. They constantly do this nonstop to their mouth as they're licking and everything. So then they get saliva all over their face and it breaks them out and everything. To me, I guess it's a sense of comfort to them that they do. How serious is the disability? Well, the disability, like I said, has no life expectancy to it. There are many stages of Rett syndrome. And it's also in the same spectrum as like autism and cerebral palsy and non-specific developmental delay. It's often misdiagnosed as that. There is a simple blood test to confirm the presence of the MECP2 mutation. However, since we know that the MECP2 mutation is also seen in other disorders, the presence of the MECP2 mutation in itself is not enough for the diagnosis of Rett syndrome. Diagnosis requires either the presence of the mutation, a molecular diagnosis, or fulfillment of the diagnostic criteria. A clinical diagnosis based on observed signs and symptoms or both. A list of labs to share with your ordering physicians that can do the MECP2 sequencing plus deletion analysis in the list of diagnosis criteria. Consider diagnosis when postnatal declaration of head growth observed. Require for typical or classic RTT, which is Rett, a period of regression followed by recovery or stabilization. All main criteria and all exclusive criteria. Supportive criteria are not required, although often present in typical RTT. Another one is required for a typical or variant RTT, a period of regression followed by recovery or stabilization. At least 2 of the 4 main criterias, 5 out of 11 supportive criterias. There's different signs that vary in different ways of Rett syndrome. There's partial or complete loss of acquired purposeful hand skills, partial or complete loss of acquired spoken language, gait abnormalities, impaired, dyspraxic, or absent of ability. Also, exclusion criteria for typical RTT, brain injury secondary to trauma, peri or postnatally, neurometabolic disease, or severe infection that causes neurological problems. Grossly abnormal psychomotor development in the first 6 months of life. There's also supportive criteria for a typical RTT. Breathing disturbances when awake, bruxism when awake, impaired sleep pattern, abnormal muscle tone, peripheral vasomotor disturbances, scoliosis, growth retardation, small cold hands and feet, inappropriate laughing and screaming spells, diminished response to pain, intense eye communication, eye pointing. And the worst thing, like I said before, was there is no life expectancy on Rett syndrome. Now let's go from the negative to the positive. There is so much research being done that they have reversed the disability in rats, but haven't done it in humans yet. The Rett Syndrome Research Program at Boston Children's Hospital, BCH, is recruiting subjects for the Phase 2 clinical trial entitled Pharmacological Treatment of Rett Syndrome by Stimulation of Synaptic Maturation with IGF-I. This Phase 2 trial will include 30 children with Rett syndrome who are female between the ages of 2 to 10 years old, up to 10 years, 11 months. Have a clinical diagnosis of classic or typical Rett syndrome, have a documented genetic MECP2 mutation, demonstrate a specific behavioral profile, based on standardized questionnaires, reside within North America, USA, and Canada, and whose primary language most commonly spoken at home is English. Subjects must also be in a stable stage of the disease, no longer experiencing symptoms or signs of regression, loss of skill. Study participants must be stable on their regimen of medications. Unfortunately, my daughter would not have passed for this test because she had no abilities and had lost everything in her. For 4 weeks prior to beginning the study of receiving services such as physical, occupational, or speech therapy, subjects must be on a stable regimen of these services for 90 days prior to initiating treatment with study drug. Additionally, study participants' caregivers must have access to the internet and be able to complete questionnaires online and correspond via email during the screening visit in the hospital. A study doctor will determine eligibility and ensure each child is healthy enough to participate in the trial. The positive note of all of this is that there is hope in all the studies that are out there, and now is an awesome thing for our precious angels. Like I said, I did not have all of this when my daughter Gia was alive, but it makes me very happy for all the other Rett angels who are still alive and could possibly be cured one day. Since my daughter was diagnosed with Rett syndrome, it has given me a passion to work with the disabled, and that is why I'm going to school for occupational therapy assistant. But I want to further my career and be the actual therapist. Having your child diagnosed with a disability is one of the worst things that you could possibly go through. But you live every day, you're just loving that child and giving them the care and needs, and take care of their needs that they need every day. And never take anything for granted, because you never know when or how or what is going to happen with your child or yourself. I always say that I am blessed to have that chance to be able to take care of Gia, that God allowed me to take care of her. She was the most blessing in my life, and I will never forget that. So in conclusion, Rett syndrome is a very rare disability that takes over the female body and has no life expectancy on it, as I said. However, there is a lot of research and studies being done on our precious angels to help come up with a cure, and has been reversed in rats already. Should every mother fear the thought of their daughter being one of the girls that get diagnosed with Rett syndrome? No. I say this because, as a mother who has faced this nasty disability, I believe that you should never fear that anything is going to be wrong with your child, and always think positive over their lives, and always trust God with them. Never fear that anything's going to happen to your child. Always speak life over them, and always know and speak that you're going to have a beautiful, healthy baby. Never fear anything with your child. Just live life to the fullest with them and enjoy every moment that you have with them. Some of the research that I went over you could find on the rettsyndrome.org site. Dr. Mike Fries from Baylor College of Medicine, International Rett Syndrome Foundation. Also, Dr. Walter Kaufman, Neuron, Texas Children's Hospital, University of Alabama, Birmingham, International Rett Syndrome Foundation. These are some of the sites that I got some of my information on, also based on my real life experience with going through everything that I went through with this disability with my daughter. I just wanted to make every parent aware of this disability because of it being so rare. Not to scare you or to make you concerned that this is what's going to happen to you, but just to put it out there, and so that everybody knows about this disability. So I thank you for listening, and I hope that this helps with many people. And like I said, never fear anything with your child, and live life to the fullest with them, and enjoy every moment with them. Thank you.